Thank you, Satya, and good afternoon, everybody. It's wonderful to be here at the fourth Foundation Day. So let me add my own congratulations and best wishes to BIRAC on its fourth birthday. Satya started by saying, fourth is actually a turning point. Actually, you are no longer a baby, and you're just getting into school, and so you have to start thinking about what your journey is all about. Though a baby is too young at that point to think about big goals and what you will achieve in life, somebody is deciding at that point. Parents have dreams, and parents want the child to be something. I was thinking actually what I would share with you today, and it was actually quite difficult. And I can talk about Infosys, I can talk about IT industry. Probably you wouldn't be interested to listen to me in this audience. So I wanted to distill something from the IT industry to talk to you about, and I'll come to that. But before I do that, I want to thank Dr. Renuswaro, Dr. Vijay Raghavan for inviting me to be part of this celebration, part of a unique, you are a unique institution, I strongly believe. You have linkages with and you support a large number of organizations and large number of startups across the country. I was actually very, very pleasantly surprised. And when you give the number of 500 startups, that is an amazing. I don't know whether there is any government organization. After all, of course, you are a separate company, but you're still part of government, which supports 500 startups. That's truly an amazing number, actually. And so there's something in the DNA of BIRAC, which I think now needs to be analyzed to figure out how we can replicate that across the government. Because that's something that we need if we want to think about change that needs to happen. You're able to attract some of the best people, actually, and that's also a challenge for the government. How do you attract the best and the brightest to join the government laterally and run these initiatives within the government? And that, again, is, I think, something we need to replicate and we need to learn from BIRAC. I think this is a model that we need to talk about and we need to replicate, not to change BIRAC, which I think will be very, very bad, but to see how we can replicate it across. So when I was thinking about what to share from my learning from the IT industry, of course, Professor Ashok Jhunjhunwala talked about funding. That's one aspect, but funding is available, and for an entrepreneur, I think they will figure out somehow or other how to get funding. And if I look back at Infosys, we didn't get any funding. In those days, there was no funding available. And the interesting story is in 1983, we wanted to buy a computer worth about 30 lakhs of rupees. And we went, of course, no VC funding, no VCs were there. Nobody understood software in those days. And when we went to banks, they said, what is the collateral? We said, software. They said, what is software? Where is it? Can we see it? Nothing. So no banks would lend us money, actually. And it was actually the state government, the Karnataka State Industrial Development Corporation and KSFC, State Finance Corporation, which lent us that money to buy that computer. So, government has, of course, they gave us a loan and we returned it within 3 years. And after that, we took a decision, we will never have to take a loan again in our life till at least we were there at Infosys. and Infosys has zero debt. And today, I'm happy to say Infosys has zero debt, because we said we will never have to, put our hands out for a loan again. So funding is very, very important, and at early stages, it's very important. And Professor Jhunjhunwala very articulately talked about the gaps that exist in the Indian funding ecosystem, and I agree that needs to be addressed. Dr. Renu Swarup talked about 500 to 2000 as one metric for scaling. But I'm very confident, actually. I'm very confident in today's India that 2000 will be reached. The numbers would be reached, because this tremendous enthusiasm, there's actually a wave around entrepreneurship and startups. Everywhere I go, any college I go to and talk to students, 20, 30, 40 students would come and tell me, I'm going to do a startup, I have this idea, I have that idea. Everybody wants to do a startup today. So you will pretty soon have large number of startups. Now, why everybody talks about the IT services industry in India? The reason I believe why they talk about IT services industry in India is because we have large, influential companies. If you look at the top 10 companies in the world in IT services from market cap perspective, 5 of them are from India, out of the top 10. If you look at the size of these companies today, $150 billion in revenue, $120 billion in exports, 8% of India's GDP, and 25% of India's exports. 4 million jobs created. Really good paying jobs. In fact, so good paying, so people complain that we don't have teachers because they go to IT. We don't have mechanical engineers because they go to IT. We don't have civil engineers because they go to IT. Everybody complains. That's the reason why everybody talks about the success of IT services industry. Size. So scale in a different dimension. And that's what I want to focus on and concentrate here. Because I feel we will be able to get entrepreneurs, we will be able to get people to do startups, we will get numbers, we have the ecosystem, the education. We have to get the timing right. I will come to the timing aspect. Regulations, yes. If I look at the IT industry, there wasn't many, regulations controlling that industry, and government kind of made key policy changes to support the industry. 100% tax break on exports was significant for the industry to invest and compete on the global scale. That allowed us to. So regulations do play an important role. But one important thing which helped us, we were at the right place at the right time, riding on a big wave. The wave of course, computing. PCs were introduced in 1981. Infosys was started in 1981. If you look at all the big companies in the IT services industry today, in India, almost all of them were started late 70s, early 80s. At the same time, actually. We were at the right place at the right time, riding on a wave. We had a big idea, which is something that transformed how services were delivered, first with software development, but with any business process. We were able to do faster, cheaper, better. We were able to do faster because we were able to use a 24-hour workday model. So work could be passed from the US to India, India to US, continuous workday model. We were able to do it cheaper because we took advantage of the lower cost economy that's India. We paid some of the highest wages. If you look at even the last survey on compensation, that was written about, that was published in India, highest paid jobs are in the software and IT services industry in India. Still, it's cheaper. And quality was some of the best, because we adopted highest quality standards. In the 90s, 67% of the level 5 companies, the highest level of quality in software, were actually in India. And hence we were able to transform, we were able to disrupt how services were delivered. So much so, today you will find that every single multinational, almost every single multinational has their back office, has their IT services being done in India, either through a partner or even through a captive. And that also, of course, benefits the country. And that's how we were able to transform. So if I look at then, BIRAC, if I look at biotech, Dr. Vijayaraghavan talked about expanding the scope, expanding the definition of biotechnology, and I strongly feel, I think there is an opportunity to expand that definition. What is the wave that we are talking about today? The recently concluded World Economic Forum talked about a fourth industrial revolution. The IT services industry is part of the third industrial revolution, which is the digital revolution, started somewhere in the early 70s, and it's continuing. But now we believe that we are at the beginning of the fourth industrial revolution. The fourth industrial revolution builds on the digital revolution, but combines with physical and biological systems. So now you can think about how the impact is going to be. When you combine physical systems, that means you are able to put a processor, a computer in everything that you want to track. That means everything will have intelligence built into it. What I'm talking about is Internet of Things. Lights will have intelligence in it. Speakers will have, projection equipment will have, cars will have intelligence built in. Everything that we can think of will have intelligence built in. That means you can now interact with every physical object. You can talk to every physical object. You can control every physical object. You can sense and respond for anything, anywhere in the world. And the third is biological systems. In two ways, actually, biological systems play a role. One is how we bring digital technology to actually understand biological systems better through DNA sequencing, genomics, and the whole aspect of understanding life itself. And the second, biological systems, is now we can think about human-computer interfaces, directly talking to living beings through use of digital technology. So again, as we did in physical systems, we are now able to interact with biological systems. You must have heard about using blue light to stimulate the brain and things like that. You are able to now interact directly with biological systems. And imagine this now, the whole world, all the way from physical to biological systems connected through digital technology. This is transformative, this is disruption, this is going to change everything that we know. That is the wave that we are starting today. Now, when we talk about such a vast area, now this is going to change everything. We need to focus on some things and we need to focus on a few things. We can't be attempting to look at every one of these things. And again, I picked up a couple of things that I thought I will share with you from the area of medicine. Satya said, I didn't get admission into medicine, so maybe I now come back after retirement, maybe I can dabble a little bit in medicine and, look at from the back door, working with the medical fraternity. So I picked up a couple of things which I believe clearly show, because the investments that go in, the thinking that goes into these things, show that these are going to be very, very big. First is, I read about Stanford University launching what is called a precision health initiative. In fact, I think about a year ago, President Obama announced his ambitious initiative in precision medicine. The goal of precision health at Stanford is to marry two disciplines that have disparate perspectives on health and illness: the traditional medicine and public health. Public health primarily keeps people healthy, while medicine primarily treats people after they become sick. Public health helps whole populations, while medicine helps individuals. That's the difference between public health and traditional medicine. But can we now combine these two together? So, for example, under the President Obama's initiative, it will enroll 1 million Americans who are willing to share everything about their health and their daily lives, including information from their genomes, proteins, microbiomes, personal medical records, and wearable devices. The fourth industrial revolution I talked about. New tools from computer science and statistics will manage and analyze the resulting gigantic data sets and help explain why people get ill and how to prevent illness and which treatment works best for whom. So imagine, you as a patient going into a physician's office and your own tests are done, the data is fed into the computer, and it then compares with millions and millions of records of that's there in the data set, and tells you, based on its own analysis and things like that, these are the potential medications that should be prescribed to you. These are the possible solutions that are available. But it's actually using the test that done on the patient, but looking at millions of records of similar patients, etc., and telling you what needs to be done. And then it tracks. As you take the medicine, it continuously tracks you and tells you, are you becoming better? Are you seeing interactions? If you're seeing interactions, you can rapidly actually adjust the medications. Because instantly you know what is going to happen. And that's precision medicine. Then I read something about a startup in the US, and this is also very interesting. This is a startup called Pearlstein Lab, shortened to P-Lab. They have created an automated drug discovery platform that helps bio startup focus on finding cures for rare diseases rather than common ones. Big pharma companies look at common ones because they have large population to deliver their drugs and get money from. But this company is looking at these rare diseases which affect probably one disease may be affecting 7,000 people across the world or something. Each is a small population. Now, according to P-Lab, there are about 7,000 such diseases that are classified as rare, and 95% of these have actually no approved cures actually. And this is the startup's focus. So initially, they want to focus on out of these 7,000 rare illnesses, about half of them are caused by a single broken gene. These are usually inherited diseases and affect children. So what is their solution? So they focus on this single broken gene disease initially because they are obviously less complex and easier to approach. Using, and many of you would be familiar with this, the apparatus known as CRISPR, which is like a command line editor, that's what they say, for animal genomes. They altered the genome of test animals, and smallest to the largest they can get it, yeast, flies, worms, fish, mice, to mimic the broken gene disorder and essentially make them ill. And after that, because these animals are small, even microscopic, the lab can actually replicate and create large number of them to test against. So they're going to test these medications against the large population. They're actually going to accelerate the testing process. So that's what they do. So they have this capability, what they call automatic drug discovery platform. So they test these drugs on these small animals. And you can imagine millions of bacteria that are infected, or millions of flies that are infected, etc. And they test these drugs, find what works, which do not work, and then immediately they can come to human tests, etc. This way they can rapidly and effectively test for cures. Another example of innovative thinking and what is possible. And again, a large addressable space itself. I'm supporting some of the things BIRAC, DBT are doing. In fact, from the time I wanted to venture into these areas, I've been speaking to Dr. Vijay Raghavan, getting his advice constantly, continuously, and I'm glad to say that I've been able to find an area where I could work with him. Recently in NCBS we announced a joint collaborative project on accelerating the application of stem cell technology in human disease, ASHD. In fact, this also has the Institute for Stem Cell and Regenerative Medicine, INSTEM, the National Institute of Mental Health and Neurosciences, NIMHANS, and the Christian Medical College, Vellore, as partners. And from a global perspective, Center for iPSC Research and Applications, CIRA, from Kyoto, Japan. I think DBT is a major supporter for this, and in a small way, I'm part of this. Another area where we have worked together is recently Axelor, which is the ventures, venture fund and venture incubator that we have created, launched a directed diabetes challenge. CCAMP is also a partner there, and we got about 97, about close to 100 applications, 99 submissions, and 5 were selected. The 5 solutions that we got selected were in glycated albumin tests, metallic nanoparticle based urinary albumin detection, neuropathy screening device. This is very interesting. Dye balls that change color for early diagnostic and eco-friendly sanitary balls. All these are diabetes related. And a real-time diagnostic and therapeutic wearable shoe insole. These were the 5 startups that got selected. So I just wanted to say that I'm enjoying this relationship. But when I look at my experience with the IT industry, and when I look at the trends that are happening, the waves that are happening, I strongly feel that we need to catch a wave. We need to actually be part of this wave. And hence, I felt that if we want to create an ecosystem together for impactful, large companies, large businesses, startups that will scale up. So individual startups that will scale up into big ones, then we need to do certain things. So these are some of my suggestions. First, definitely we have a large population. Providing them affordable healthcare, both preventive and disease management, is of course a national priority. And this should apply to academic and private sector research. And so we need to create large number of startups who will create solutions that address these issues. We are going to see large number of problems related to lifestyle diseases, including obesity, diabetes, cancer, etc. Already 4 million people are affected with Alzheimer's in India, and each costs 20,000 rupees. That means about $1.2 billion, and it's estimated to go up actually. Now we have a a genetic makeup and heritage that's different from rest of the world. So we need to understand how medicines work on our population. We need to make our medicines and the cures that we find affordable to a large percentage of Indians. That means it has to be affordable, it has to be inclusive. I also believe that by doing the research in India, we increase the number of people working on these problems. Already it was mentioned that we have very high quality people here. The cost of research will come down and we will find cures faster. So hence, India participating is a win-win situation for everybody. And I also believe that we have a unique opportunity to contribute because of our traditional medicine, Ayurveda, yoga, spirituality, meditation, etc. How can we bring them into under modern science and scientific research and things like that? So putting it all together, the unique opportunity that we have. So I'm going to talk about 4 things actually. I believe we need to create a very large population database of healthy individuals and track them continuously for life. Imagine the big data set that we would create and make these now anonymously available to startups across the country. The output of Mars' first attempt in the world, we landed. We can do it. So why can't we say that we are going to find a cure for cancer in India? At least some form of cancer in India. And let's, put all our resources together, startups to large companies to academic research to government. Can we launch a national initiative, precision medicine initiative towards cancer? The third is, and this is again unique, can we launch a large scientific program to study the impact of traditional medicine and using modern tools? And that's the opportunity that we have of DNA sequencing, MRI, wearable healthcare devices, blood tests, and all that stuff. Can we now look at the impact of traditional medicine, yoga, spirituality? Again, unique contribution by India to healthcare in the world. 4 initiatives I talked about. I believe if we launch these, we can take part in the wave. We can take part in the opportunity that this provides. We have a huge market in India, and we have a huge opportunity to contribute to the world. I'm sure that with the talent and the experience that we have with organizations like DBT and BIRAC, we can come out with, and I just gave 4 examples, few national mission mode programs. In my own small way, I talked about the InStem Cell program at NCBS. I'm also supporting the Center for Brain Research at IISc. We need many more such programs. So that's my thought. Those are my thoughts today as you look at how do you scale up. I believe that we need some overarching, big, ambitious goals, taking advantage of the tools and the techniques and the technology that's available with us today, and crack some big problems. Thank you very much.